In the head-to-head series, I show you images from two different patients with two different diseases and a similar radiologic appearance, and you see if you can tell them apart. Here's patient 1. You can see that there is a large frontal mass that is distorting the ventricular system. Here's some MR images of patient 1 that might help you out. You can pause here to take a careful look at these MR images. Here's patient 2. This patient has a large frontal mass. Patient 2 also has an MRI, and again, you can pause here to see if you can figure out what this diagnosis is. If you haven't already, pause the video and come to a conclusion about what you think is going on. Let's have a look at these two CTs. These both have large frontal masses, but patient 1 has a very regular rim and there is no surrounding edema. This patient has also had prior surgery here that probably affected the frontal sinuses. In patient 2, there is a lobular mass with a thicker rim and a ton of surrounding vasogenic edema. When we look at the MR images, we see that patient 1 has a very thin, regular rim around the mass, and it is oval in shape, whereas patient 2 has an irregular mass with a thickened rim of enhancement that has variable thickness around the perimeter. Importantly, patient 1 shows no evidence of restricted diffusion within the contents of the mass, whereas patient 2 does show restricted diffusion. Does that help you come to a conclusion? Patient 1 has a mucocele. The frontal sinus has been previously violated and it has enlarged because of obstructed secretions, and sometimes an obstructed mucocele will extend into the intracranial vault and impinge upon the brain, like in this case. Patient 2 has a classic brain abscess, and the restricted diffusion should really put you over the edge if the style of enhancing rim and the extensive edema didn't clue you in already.